The latest COVID vaccine rollout isn't just another booster, but a whole new strategy. For the first time, the CDC is leaving this decision up to you and your doctor, while the FDA limits approval mainly to older adults and those who are considered high risk. So what about the rest of us? Here to help us sort this all out and break it down, a look at what's changed and what's next. We're joined by Dr. Mehul Suthar from Emory's Vaccine Center. We appreciate you, Dr. Suthar, for joining us this morning. So how much of a difference could this updated formula make when we're talking about protecting ourselves, especially heading into these winter months?
Thank you for having me. So the updated COVID vaccine is not much different than last year's COVID vaccine. The COVID vaccine in general encodes the spike protein, which allows the virus to bind and infect cells. The COVID vaccines themselves generate antibodies, in particular neutralizing antibodies, which help block the ability of this virus to infect cells. So over the course of the pandemic, there have been many different variants that have evolved, and the current circulating variant is what's called the Omicron variant. A couple of years ago, the COVID vaccine moved to now a monovalent formulation, which means that it encodes for a single spike protein. This year's monovalent vaccine, it's still a monovalent vaccine, but it encodes for a slightly different version of the Omicron variant called the LP1.8.1. And this COVID vaccine should be able to provide really good protection against these circulating strains.
All right, so how effective are these updated vaccines when we compare them to earlier versions? What are they looking like now?
Yeah, so that's a great question. And our team here at the Emory Vaccine Center, using a couple years prior COVID vaccine, which contained that XBB 1.5 spike protein vaccine, was able to show that we can generate an antibody response that lasts 3 times longer than what we've seen in the prior years. This is great news, which means that we can stay protected for longer periods of time. Reports have shown that we can expect to see somewhere between a 40 to 50% effectiveness against emergency department visits, urgent care visits, hospitalization, severe disease, and death. And we expect that this upcoming COVID vaccine booster dose should be able to provide similar levels of protection.
All right, so Dr. Suthar, the FDA is now limiting, as we mentioned, approval to those mainly at least who are 65 and older, or those who have certain medical risk or are considered high risk. So looking at a public health perspective here, do you think those boundaries are too narrow?
So that's a great question, and it has been confusing over the last few months as to who can receive the vaccine and sort of what those recommendations are. The updated COVID vaccine booster dose is available to anyone over the age of 5 or older. The recommendation is that the vaccine should be taken and should be prioritized really for people that are above the age of 65, those with weakened immune systems, certain pre-existing conditions. They should really strongly consider getting the updated COVID vaccine booster. And if you're unsure, you should go talk to your primary care physician or your local pharmacist to see whether you are eligible for the COVID vaccine.
Mm-hmm. You know, Dr. Suthar, this is probably a good question for a lot of people as we're heading into the winter months, as we're getting our vaccines. How can we tell the difference between if we have the flu, a cold, or COVID?
Yeah, it's sometimes very difficult to tell whether you have the difference between these respiratory infections. Certainly there's rapid antigen tests that can allow us to be able to differentiate between flu or COVID infections. But what I would recommend is that folks really try to stay updated on their COVID vaccines as well as their flu vaccines. You can get both shots at the same time. And this allows us to stay protected against both of these viruses.
All right, Dr. Suthar, some great information as we're all, like I said, heading into these winter months. We appreciate you as always. Thank you so much.